Hi, everyone. Good morning and welcome to today's CoverageforOne webinar with Medicare Advantage and SNPs. My name is Chelsea Smith. I am a Learning and Development Specialist here at Action Benefits. And today, like I said, we are going to go through some of the Medicare Advantage plans and SNP plans using CoverageforOne, our enrollment tool we have offered to you at Action Benefits powered by Sunfire. So welcome. Thank you very much for showing up. Hopefully it's not snowing near you. I didn't know it was going to snow until Jessica told me this morning. In our corner of the office, it does not look like it started snowing yet, but Jessica, why don't you introduce yourself and tell everyone if it is snowing near you so that they know what is coming.
It's definitely snowing here in Fenton. We're supposed to get 5 inches. So I'm Jessica Schmaltz. I've been with Action Benefits for almost 11 years now. Over the Medicare and individual, but I started in group. So well-rounded here at Action and have a history with CoverageforOne. So I'm excited to be here and kind of walk you through that history too.
Awesome. Very glad that Jessica's here with me today to help give that rounded background of the history of the platform, because I have not been here long enough to know the history of what CoverageforOne once was. It was a platform that we had created a few years back, and then it kind of was resurrected in the last year or so. So thank you for joining us, like I said, and let's go ahead and hop on into this platform. And Jessica is going to interrupt me whenever she feels the need and desire so that we can get as much information about the platform out to you as possible. So without further ado, I'm going to turn off my camera for reasons of it usually kind of gets in the way of some of the stuff I click on, and no one wants to watch me get clicked on. And also I make a lot of these faces when I'm looking at something, so you don't want to see that. So if you were to start your CoverageforOne journey with us, you would have gotten a link that comes directly from us that is your specific link that works for you as an agent. I am not going to use my own personal link. I am going to use the demo link for the purpose of you guessed it, demo. So mine's going to say demo, yours is going to say whatever your personal link is. If you don't know yours, please let your account manager know and they will get that out to you. Yours will say your name here. Mine says the demo name. That's where you would click to start your journey. This is what it would look like if your client was looking at your website. So they would see the get a quote button here. They would see presented by, they would see you. If you gave us a photo, we would put that there for you. We put a camel. Camels are awesome. And you have your address, your information would be there. We just put our information there for demo purposes. You, however, would see a login button here. You would click login and then you would log in. It would look like this. So as you can see, this would be your dashboard for the entirety of CoverageforOne, not just the Medicare side that we are going to be talking about and spending most of our time in today. So I'm going to go from right to left here, just because I think it's a little easier to talk about, but most of the time I'm going to go left to right when I discuss what's on the screen. So you'll see some of the data points that we'll have created for you to see your all of your business you do through Action at a bird's eye view through, or at least your individual business as a bird's eye view through this dashboard. You will see the days to individual Medicare until AEP and OEP. You'll have graphs that will demonstrate, as you can see here, your enrollments to date and your enrollments with certain carriers. Because this is a demo account, not much going on. You'll have a lot more going on in your stuff than we do in ours. In the center here, you have your off marketplace submissions. You can kind of see what's been going on, and it goes from earliest to least early, so you can see that. And then all the way over here on the left-hand side will probably be what you will spend most of your time clicking on this dashboard. I will briefly mention that your off marketplace enrollment tool is here. You would click start quote if you had wanted to do that, but that's not what we're here for today. So we're just going to admire it and move on. Then we have the on marketplace for your individual under 65 business. This is where you would click if you had wanted to do that, go on to an individual quote, but again, not what we're here for today. So we'll quickly admire and move on. We'll click on the Medicare button momentarily once we get to that portion of our journey, once we're going to leave this platform and head into the actual nitty gritty of what we're here for today. But I just also wanted to point out, if you ever needed any help at any point during your journey with Coverage for One, you could click right here on individual@actionbenefits.com, and you would be sending an email to our individual team, who will be more than happy to help you with anything that you need to get you going here with Coverage for One, and the phone number is there as well. So I think that's everything I wanted to cover on this dashboard. Jessica, is there anything you'd like to add before I click on the Medicare Start Quote button?
I'll just jump in here and say, that first screen that you were on, that's the historic resurrected Coverage for One site. So that green get a quote button, that's only for off marketplace quoting. So this is essentially your landing page. And to Chelsea's point, you would have that blue login button in the top right hand corner to take you to the dashboard. And that dashboard is only showing your off marketplace quoting and enrollment through Coverage for One. It doesn't import your entire under 65 book of business. And then if you wanted to get to that Medicare site that you're about to see, you'd click that Start Quote button. This facet of Coverage for One is new, this dashboard. It's kind of cool. We didn't have it before. And it just allows you to see what's happening when people go in. Maybe you're putting that link out there, your unique Coverage for One link for your members. So you're able to see if people are actually quoting and enrolling through your platform. I think that's it for now. Chelsea, I will turn it back over to you.
Perfect. Thank you, lady. Yes. I do like, as I've never been an agent, but as someone who does use this site often for demo purposes, and someone who compared the old school way when I first started here, where there was 5 different places to log into things, I feel like if I was an agent, I would definitely appreciate the fact that all these links are in one spot. And I could not have to memorize all these different areas to go to, all these different websites to get to my my business. It's all in one spot. So because this is a demo account and not an actual account, if I click on this, nothing happens. So I'm going to just hop on over here to the Coverage for One website portion that's powered by Sunfire. This is what it will look like. It looks the same. It just, the links don't work in the training environment. So thank you for your patience with that brief moment where it looked a little different than it will for you. You would then log into your Sunfire account at this point. Your Sunfire account information should be given to you. It is your password and login are your login information that you do already use with us, your email, and then your password would be a capital X plus your NPN plus the first 3 letters of your last name, all in lowercase. You can change that password once you log into this account, if you so choose, down here with this little gear. And then you can see up here your username, password, reports you can change or generate. This is all, dummy information since it's the training account. But this is what that screen would look like if you so choose to do that once you log in. I even made a cute little training signature. I practiced signing so that I didn't look silly when I had to sign something with a mouse today. So hopefully it doesn't distract you too much. So this is, be aware, if you would need to change anything about your Sunfire account itself, that's where you would do that. So before we go into anything else, this is the screen that will come up when you first log into Sunfire. The only difference is it's not a training account. If this were me using the account, using this account or using this platform, the first thing I would do would depend on if I had the person already put in as a contact or not. I'm going to walk you through, mostly assuming that you don't have that person put into an account already, or as a contact, I should say. So that you can get a feel for how to do that as well. But I will show you quick little tricks that if you already have your contact entered into Sunfire, how you can more quickly access the information you have for that individual. But like I said, we'll start as if we had a brand new contact that we did not ever have any information added in before. So the sidebar here and the buttons at the top are generally the same. Your home button here. And the first one is going to be your contact button. The little people, they match. So if it were me and I was putting in a new person, I would just click search contacts. You can search the contacts if if you already have the person in, you can search here. So let's say, for instance, we'll put me in, I put myself in the other day. Search me, here I am, you can see I was practicing a couple days ago. And then the other days that I was using this account are all in here for me. If you want to put in a different person, maybe we use the last name test sometimes or like that. All the tests, so you can see lots of different people in there. If you had interacted with the person in the last 30 days, they are going to show up on your homepage, so you won't have to do all this, it's even easier. But if it's a contact you haven't talked to in a while, haven't done much with in a while, you would have to search through these contacts. But let's say you wanted to add a brand new contact, because you have a brand new person you are working with, you would hit that add new contact button. And you would fill out the information that it is asking for, just like any other platform, any other thing on the internet. The star means that it is necessary to create the contact. But as always, I'm going to recommend to you that you put in as much information upfront as you can to save yourself time later when you're with the client. So just to make this a little faster, I'm just going to put in some dummy information here to get so we can create a contact really quick. That's not my real birthday. I am not that old. So then you also could put in a power of attorney down here if you wanted, if that person has that situation. You can save at this point, save the contact. You can hit close, or you can save and hop right into that quoting environment if you wanted to do that. But I would recommend kind of just saving it so that way you can go and do your scope before you even head into doing anything else. Once you create that contact, you'll see that person's name up here at the top. Then you are functioning as that person when you're going to do quotes or quoting for that person as you go through the platform. You can then either switch it to some other type of contact and save it, or you can also switch to a new contact. Right, that winds us down for this screen. I'm going to head back to the home page really quick. So as I said, the next step for you probably with a brand new person would be to send a scope. There is a button, as you probably already noticed, that says send a scope, and you can click on that if you want to, and it'll show you all your scopes that you've done lately. And in this top right-hand corner here are the 4 ways that you can send a scope to one of your clients. You can email the scope, text the scope, complete the scope just on your screen. If you had, like, let's say you're using a tablet in your office, I would recommend doing the complete scope this way, and you'll see why in a moment. Or you can upload a paper scope. Maybe you're somebody who just really likes to have those hard copies available, and you do that in your business. You could hit that upload scope, scan it in as a PDF, throw it into CoverageforOne here, stores it for you. All 4 of these versions, regardless of how you choose to use it, will store that scope for the amount of time that it is necessary to be compliant with CMS. So that 1 year plus 10, Sunfire will store that for you. No need to worry about it so long as it's there. But if this were me, I would actually come over here onto my list of contacts, and I would click on that person, this action dots here, and I would click send scope of appointment this way, because then you can see if you've already sent a scope to that person. See, now we have you can see I was playing with this on Monday. You can see the scope I have already sent and what day the appointment was. And then you can send them if you needed to. If you need to send another scope, you can send that way. So let's do another one. We'll send it to the person that we just did. So really easy to walk through it. Anytime you see these boxes here on your screen, you know that that is a compliance portion of our show or of what you're doing with your client. So that's another reason I really love CoverageforOne. It does force you to stay compliant. It will not let you continue until you check off one of these dials here. So for me, because I like to just keep my butt covered and I like to talk about make sure I have every single item checked off. Obviously, if you don't want to do that, you don't have to, but I like to check off every plan just in case. And then because I clicked on that person in the list, a lot of this information is pre-populated for me. So the name and all that jazz is already in there. You already know you're going to get the phone number correct. If you had clicked on it, just sending a scope without this person connected to it, that information would be added in by you at this point. Then you would have to just fill in all the things you need, again, to stay compliant. These little asterisks tell you that. So I'm just going to put in walk-in for the sake of our demo. And then you add in the plans that you're planning on talking about. Again, I just put them all in just in case. We can then add in the day of the appointment. Today is 2/15/2024. That's how you know this is a live demo. I'm not a robot. And then you would say when the person added it in. And then because we clicked on the sign scope button this way, this box will be here for you to hand the iPad, hand the tablet over to your client, and this is where they would sign. So I practice this. Hopefully it's not too messy. Oh no, it's going. All right, well, you get the idea. And then you can save the signature for them, and then they signed your scope. If that person has a relation, like if they're the power of attorney, they would put that in there. Signature is saved, and then you would just hit save down here. So you've created that scope. So now you have to sign that scope though. So you'll notice you come back to this screen, you'll see my old scope right there that was sent through a text to me. I texted it to myself and then I signed it myself here. So now I, as the agent, am going to see this on my screen. And I can hit sign and then, whoa, it's signed. And you'll see when you go to view that scope, you'll see your signature here. See, I made a pretty little training signature and it looks just like this. And like I said, it is stored for the amount of time that CMS requires you to be compliant, that 10 plus 1 years. And then you can save it right here, this blue button, save as a PDF if you would like to save it in another place. If you're crazy like me and you like to save things in multiple places, that is where you could do that. So scope of appointment, very easy, forces you to be compliant, stores it for you, email, text, in person, upload one, any way that you can dream of to put in a scope, you can do that with that client. Okay, so I'll head back to the home screen for us. Jessica, before I move into the quoting process, is there anything you'd like to say or add before we keep on keeping on?
Not right now.
Perfect. Okay. So the next portion, as you can probably imagine, is going to be kind of like our quoting portion of our show. Again, I'm going to focus on the client person I already made here. If that person would like to shop on their own and kind of see what's out there without themselves, I know as a millennial, I like to kind of look around and poke around myself before I talk to a human so that I know what's going on. You could hit this button here, send the action button first, I should say, the 3 dots next to that person, and they can send personal URL. If you click that, it'll show the first and last name of the person and the way in which you will be sending that link. So that's my action email. If I were to hit send here, it would send to my action email, my PURL, and then not only will that person be able to shop for themselves, you'll be able to see what they were shopping for and kind of get an idea of what they're looking for. Very helpful, useful tool, I believe. That is, I don't want to say completely unique to us, but not every carrier has that in their platform. So if you're someone who really enjoyed using that PURL and we're worried about not being able to do that from your other carrier to CoverageforOne, that is still remaining intact for you. If that's something that you are interested in or matters to you. But just for the sake of the demo, I'm going to go ahead and quote and enroll from the quote and enroll button here, but you could, as you probably saw, do it with the person. Oh, it's still stuck on me. So I'll take that client off so we can start from the beginning. So if you're starting from the very beginning with a person across from you or over the phone, what have you, you would see a screen like this. Anything, again, in blue is going to be what is forcing you to be compliant. It will not let you put in that Medicare number until you check this button here that makes sure that you're saying to your clients what needs to be said to remain compliant. So check that button here. It says, to get started, I'd like to get your zip code, Medicare number, and date of birth. So if it's in that blue box, make sure you say it to your client. So there again, I said it. I'm going to now fill in that information. Some of it's pre-added in for our convenience. I'm going to throw in that Medicare number really quickly. But I don't want to give away someone's information, so I'm going to do it over here on this screen.
Chelsea, while you do that, I'm going to jump in.
Do it.
In the settings feature of Sunfire, you can actually, as the agent, load your signature. So you don't actually have to sign the scope every single time if you have it saved in your Sunfire platform. in that settings feature, then you could just apply your signature every time.
That's what I had done as well. I mean, I think I showed it to you briefly, but that is available to do. So that way, like you said, you don't have to sign it every single time unless you really just, that's your thing and you want to do it. So I did put in that, and that the date of birth, the Medicare number, and the name of the person, or zip code, I should say, of that person. Then you would select the type of plan the person is looking for. We're going to start with special needs because that's what I promised you here today, that we were going to talk about Medicare Advantage and special needs plans. So we're going to start with those special needs plans. Are you currently enrolled in a Medicare Advantage prescription drug plan? You could answer yes or no. Because I put in a Medicare number that is not Medicaid eligible, that is what this box is going to say when I hit special needs. It's just going to say, hey, this person's not eligible for Medicaid. But if this person was eligible for Medicaid, it would list that in this box here. So sorry, I don't have a Medicaid number that does show that, but just use your imagination. That's where it would be. Next, you could put in the PCP. As we know, that can be a very changing decision-making factor, whether or not that person can see their PCP. That might be a thing that person cares about. So I'll put in mine just really quick. Oh, that's our first name. Come on. So yeah, we'll just pick doctor. That's my doctor. Then you require disclosure. So this will help you. How frequently does this person use medical benefits? Rarely, occasionally, frequently, or unknown. So again, there's that unknown. If you don't know that thing about that client, the client goes, you can do unknown if you'd like. I usually try to hit occasionally, just so that I kind of I'd rather kind of give them a little more room to mess with the prices. So I usually kind of hit occasionally. Then you can always go back. You'll see you can always go back and change later. So next, pharmacy and medications. Are you currently taking any medications? If you are, you put that one in there. So I'm going to, not to be controversial, I'm going to pick Ozempic just to show that it is in here. Save the medication. It's in there. And then let's just throw in inhalers. It's a common thing. They'll highlight the most common dosage, because I don't know about you guys, but I've been taking an inhaler since I was 17 years old. I could not tell you what the dosage is off the top of my head. I have no idea, but I just know it's like the one that everyone has. So I like to show that, hey, if that person doesn't know it, we'll highlight the most frequent usage and dosage and all that jazz. So then you can save that medication in there as well. Next, it will ask you if there is a pharmacy that this person uses to fill their scripts. Yes, you can hit yes or no. I like to just I'll hit no for now, just so I can show you something later. Then do you receive extra help? To remind you of the copays, no. And then here are some questions that are going to help you be a better agent for your consumer. You can check different things that person might focus on. It'll let you check more than 3, but we'll just focus on 3. So let's just say they really want to have some flexibility to see any provider. They don't really care about their PCP. This is important because Sunfire will order your quotes on the screen that we're about to see, kind of based a little bit on some of these focus questions. You'll see what I'm talking about in a second. But if you have a consumer that's very interested in travel and transportation, what have you, it might, if there are plans available in that area that have those benefits, it might bump those higher up in the algorithm and show you those plans more readily because you said, oh, this person's very interested in transportation, if that makes sense for you. So, all right, we have all this rip-roaring ready to go. Let's go ahead and hit view all plans. It will take you a moment to load that for you. That's how you know that it is giving you everything that you need. So we have on here the list mode. It takes you immediately to list mode. As we go through these plans, the first thing you are going to notice is that you can toggle by plan type right here on the left-hand side. So we started with special needs. That's what we said we were going to talk about here today. But you can toggle to other items as you so choose. It might take a second to load sometimes, but you can toggle to those other plans if the consumer really changes their mind or if you want to show them other things. You can also filter by what type of plan the person might be looking for by feature. So maybe they're really looking for a 5-star plan, or the Part B give back seems to be a big one that carriers talk to me about. Maybe they heard about that. Oh, my neighbor gets their Part B reimbursed. You can check that box and it will only show you Part B filtered plans. You can filter by retail pharmacy, by carrier, by premium, doctor, network, all that jazz. So lots of different ways to play with the algorithm to have it show you what items you'd like to see in what order. But if you don't pick any of these things and you just leave the radio dial where it is, it will show you plans based off of the questions you answered in the focus and what it sees as most beneficial to your client based on the answers of like their medications and their doctor, so on and so forth, and the cost.
Chelsea, I'm going to jump in here because you were talking about the things on the left-hand side. If you notice the companies, it only shows Humana, Priority, and United right now. What you're going to see is different than what's showing on the screen, but it's going to be based off of who you're appointed with and then what carriers you have us for as your GA. So if we're your GA for all of the carriers that you're appointed with, then all of your carriers are going to show. Just want to point that out.
Yeah, very good point. I didn't think about that. Yes, because this is the training environment, it is going to show me all of the carriers that Action works with that we could potentially have there. But let's say you're Humana strong, you just really love Humana, that's your jam, it's only going to show you Humana. Good point. Okay, so as you can see here, let's just take a look at this first one here so I can give you a walkthrough of everything that you'll see. So the first thing that you're going to see is the name of the plan. It'll tell you that it's that PPO D-SNP. United Healthcare, who sells it, the plan number, the star rating, and then helpful for SNPs. This is why we did this with SNPs. This portion, at least with SNP, it will tell you what cost savings plan that SNP works with if it's a D-SNP. So you'll see this one works with only these cost savings plans, and then if it's one that still works with all, it will say all. Let me see if if it recommends a C-SNP or not. If it does, oh, here it is. Okay, so if there's a C-SNP, it will tell you in the name of the SNP what conditions it is meant to treat. So there's no, obviously you did not put in that this person had a condition, so you won't know if that person qualifies for that plan per se. But if you've worked with Humana, you know how that process works. You get a note from the doctor, verbal note from the doctor confirming that they have that condition. But for now, you would just know that that person would have to have that condition that's listed there in order to get that plan. So heading back up to the top here, you'll see the max out of pocket is next, the medical deductible, drug deductibles. You'll see kind of an overhead view of the type of benefits that this plan will have for you. You'll have your pharmacy listed. It'll estimate your annual drug costs based on the drugs that you put in up here, right? Or previously. You can change them up here though. So let's say you're hanging out with your client, you're listing the drugs and like, oh, does that number sound about right for how much you pay for drugs? And you're like, oh, wait, that sounds really low. I forgot that I actually take this and that too. Okay, so then you can go in, add that medication right here, type it in, just like we did before, add in this and that, whatever. Or maybe that person goes on, what is the pill? What is the one we can search? Anyway, they go and they search their drug and they're like, oh, I'm actually going to go take an over-the-counter version of that. You can remove a drug. Okay, we're going to assume you're not going to take that one that way. Obviously, Ozempic is not a drug that you can do that with, but if it was one like that, you could then go ahead and go remove it, save it, it'll reload. And you can see the new recommendations that the algorithm will make based on your changes. You can do that with anything that you put in that might affect the quote. So the doctor, the pharmacy, medication, and the frequency of using that care. Cool. It will continue with the doctors here as well. Same thing. It will tell you whether or not that person has a location in the network. If they do, it will tell you, okay, this person is in network. Unfortunately for me, This doctor is not in the network of the plans it's recommending, but it does allow out-of-network doctors, and it will tell you that if that is the case. Again, if that doesn't matter to your client as much, you could come up here. You could even remove the PCP if you wanted. You got your monthly premium over here on the right-hand side and the estimated annual cost over here on the right-hand side as well. That will be based on the drugs, the frequency of care, whatever. So as you saw, because we took Ozempic out of there, the seriously it got a lot lower. So you can play with that data as you choose with the buttons up here. Okay, so let's say your client is kind of, you know, hitting it off with this one a little bit, but isn't ready to make the jump, wants to kind of take a look at other things. You can hit this checkbox to compare or email. It'll populate that plan into this area here. You can hit select another plan. You can hit it and add more plans in. And then you hit the email button and it would email to this person, excuse me, the plans you checked will be emailed to them with whatever email is on file for that client. Same thing I heard word on the street was some carriers enrollment tools don't allow you to do that. And that is another feature that we tried to keep intact for you that we heard was one that you liked. So we tried to keep that for you within CoverageforOne and Sunfire. So that is an option for you. You can email that right to the client. They can go home, sleep on it, whatever, come right back. Okay, so we have the list mode. That is one way that you can use this tool. Just to keep it fair, I'm going to now switch over to the MedAdvantage plans while I show you a different way to view some of these plans. If you wanted to stop here, maybe your client just fell head over heels for the first plan, great, cool. You can just hit that enrollment button. We'll get to our enrollment portion in a moment. But for now, I want to show you one more thing. Let me check the chat, see if there's any questions before we continue, or Jessica, if there's anything you want to add before we keep on.
No, I'm okay right now.
Cool, awesome. All right. So if, let's say you wanted to give more of a deep dive into some of these plans, maybe your client has more specific questions, you could go, you know, click on the details here and go through all the paperwork, or you can click X-ray mode. I love this called X-ray mode. I just do. Okay, so you click on X-ray mode. Again, it will show you the list. It will change the view slightly. The list of the plans that it recommends for you stays, the order stays the same. And they're on the left-hand side here now instead of on the right. But that's because it's going to show you a lot more details about said plans. So, okay, now we have your benefits listed here with coverage information and estimated health costs. So you'll see that one of the doctors is a network. They have that tier 1 coverage for this particular plan. That albuterol will be covered there. Same thing, just like before, you can add or change. If you wanted to throw that Ozempic back on there, you could do that. Bam, it would come back into your quote here. Then you have your estimated annual drug costs and estimated annual health costs here. Then we get into a little more details than the regular list mode as to what this plan has to offer. So you'll see green check marks next to things that it does cover. And then you'll see these black X's next to things that this plan does not have, which is helpful. Again, if you have a client that's really fixated on one specific thing, maybe they really need to have dental because they have dentures, they really need that dental coverage. Maybe they really want to have that Part B give back and that plan does not have that. Then you'll see, oh, this plan's not for this person. There's no Part B give back there. So that's a little overhead, and then we can get an even more nitty gritty here with some of the additional services that would be listed in this plan or offered in this plan. So you can see we have some of our co-payment for health education. All these little nitty gritty details would be in this additional services portion. Meal benefits, co-payment for caregiving enrollees, you know, telemonitoring, the fitness stuff, all that. So all that is listed in there and what their co-pays might be for some of the things that are involved in that. Then you go in and go on to your deductibles are in here and your out-of-pocket limits. Next would be your doctor and hospital coverage. We're going to see some zeros in here because of the MedAdvantage plan, but you'll see some of those co-pays, primary care copay, specialist copay, so on and so forth. acute hospital services for inpatient care. So if your client has any questions regarding any specific things that they might have experienced with another plan or in their lifetime, oh, I really had a problem with my hospital coverage with such and such plan. What are the costs there? You could look right and show them right here in the X-ray mode. It will also kind of give you some other preferred pharmacies in case they really like a certain pharmacy. You can see those in there that are there. You've got your dental outlined for you, max plan benefits, how much you'll pay for some of those preventive dental services. Hearing and vision as well. I don't want to make you read all this, but it is in there. And then once you get to the bottom, you'll see, in case you'd rather look at it that way, you've got your summary of benefits, your pre-enrollment checklists, evidence of coverage, and your star ratings all the way down here at the bottom. If you click on the benefit details tab, you get some of those more value-added benefit type things that are here. You've got your additional services. You can see, we've covered acupuncture, ambulance services. They're in alphabetical order. Ambulance services, chiropractic services, dental services, diabetic supplies, doctors, so on and so forth. The list goes on, alphabetical order. You can see if any specific benefit that person's looking for, go through that list, you can find it. Drug cost details, this is kind of cool because it will, based on the information you input, with the medications, you can go through and it'll tell you month to month what the drug estimate will be for your client. Obviously, if they, go to, get sick and need medications outside of what you predict that they're going to need, that's going to change a little bit, but whatever medications you put into the quote will then show month to month what that will cost based on, because as we know, different coverage phases are going to change. I don't think it's not going to change for this one since we only have that one medication in there. They're going to stay in the initial coverage period the entire time. But if you had someone who would hop into those other coverage periods, that would then display there and it would change the costs as you go through month to month. So pretty cool if that person is worried year to year about their drug costs in comparison to just month to month, you can highlight that for them very easily in this drug cost details tab. And then last but not least, we got the health cost details tab. So this again would be based on how often your person sees their doctor. That's their services are estimated here. Maybe you estimate they see their doctor 10 times a year, not going to cost them anything. Maybe you estimate that they're going to see the emergency room once a year. Hopefully not. Fingers crossed that your client never has to see the emergency room, but if they do, that's how much it would cost. And then it will put an estimate for you up here of how much they think it will cost you yearly for this plan as you use your services. So then you could then, as we talked about, hit up here, toggle the amount of time that person sees their reviews certain medical services, hit save, and it'll change the estimates. And then if you really liked it, after you went through all that information with your client, you can just hit enroll. So I know I just threw a lot at you and it went kind of fast. If there's any questions that go ahead and share them now. I'm going to check the chat really quick. Jessica, feel free if you want to add anything.
I just want to say, I think this is a really innovative tool. It takes you away from having to go onto Medicare.gov and do all of this, or even on the carrier websites. I mean, you're able to compare multiple plans, at least for those that were your GA for. So use it.
Right, multiple plans, multiple carriers, right? If you don't have to hop over to Priorities tool, if your client's not feeling blue and they really want to hop over to Priority, you don't need to go switch to another enrollment tool and, oh my God, do I remember my password? No, it's all right here. Literally, if you wanted to go to you're on a Priority plan right now, I just clicked on one, you just click, boom. Much faster than, oh my God, I forgot my password. Because if it were me, believe you me, I would not have that password remembered and I would be fiddling around while the client was just watching me. Okay, so let's just say for sake of what we're doing here, this person wants the BSAN Advantage HMO PS Prime Value HMO. Let's go ahead and just hit that green enrollment button so I can show you the enrollment process very quickly. Not anything crazy. So it will start you here to begin the application. You can see the summary of benefits here if you so choose. And again, we see those blue boxes, so we know that this is where Coverage for One is reminding me to be compliant. So we're gonna say what's in this box to the client. It's important that you understand your benefits. Would you like me to review them with you before we keep going? It will not show anything else for you to do until you check that box. Check box, you review the benefits, if that person does want to do that. And then it creates a nifty little checklist for you. And you can check off as you go through them with the client, which items you go through and which ones you don't. It will not force you to do this. You can just check the button if they're cool and they're ready to keep going. You can just check the box and move on. But if you really have one of those clients that wants to go through every single thing again, you could do that, and you could use that checklist to say you did all those things to make sure you hit them all. So once you have that, check that box. Do you understand all the benefits included in this plan? You would hit yes. And then who is completing this enrollment? You can leave it on the applicant. And Chrome will autofill some of this for me, so you don't have to watch me put all this information in. But then you put in anything that is necessary. The little asterisk, as you probably already are aware, we've seen before, got the little asterisks going on. Add in the information you absolutely need: date of birth, gender. Would you like to receive the plan via email? Sure, you can email that stuff out to your clients so they can see. Have the address there, already autofilled, so you don't have to watch me do that. Then this one is required, the race ethnicity question. You can choose to answer that or choose not to answer that. No problem. And then if you have any language or accessibility needs with your client, you can choose to have any of the enrollment process be sent to them or through this process in Spanish or in large print or in an audio form if you have someone who's hard of hearing. So once you have all that filled out, go ahead and hit next. So then this is the portion where, unfortunately, I do have to say you do need the Medicare number at this point, no matter what, obviously, for the enrollment. So I'm going to scooch over really quick, put in that Medicare number while you look at that picture of the Stanley Hotel. So we've got that Medicare number in. Once you put in that Medicare number, it's going to ask you how that what enrollment period they're in. I just hit SEP, or let's just hit other signs, put in something. All right, so then you can, it will automatically put the first of the month as the proposed effective date. And then any other questions? Will you have any other prescription drug coverage when this plan becomes effective? Yes, and then it will ask you to put in that policy, or you can just hit no. And once enrolled, will you or your spouse work? Yes or no? And then go ahead and hit next. So plan details, making sure that you have discussed this with your client to their satisfaction. Do you understand that this is a Med Advantage plan that has a contract with the federal government and is not a Med Sup plan? Do you wish to specify a PCP now? Then you said you already have a PCP in here, but if you didn't, you would put that in now. If you don't put one in from the get, it will prompt you to put one in again. It'll say, hey, you sure you don't want to put this PCP in? Because they might assign you one if you don't put that in. It will ask you that again. Ask you who are currently a patient with this provider. And then it'll ask you to choose a payment method. So you say, withhold from your Social Security check, pay for your bank account, what have you. So it'll tell you, hey, it might take a little longer, 2 months to approve that deduction. Go ahead and hit next. Oops. Oh, I forgot to put that. I don't want to do that. Sorry about that. Hit next. All right. So here we are. We can review this plan. Everything, make sure everything is I's dotted, T's crossed. Then you would read that information, acknowledge it. And then, as you know, they're going to have to sign for that plan. Just like the scope, you can text, email, e-sign, or have a signature pad. If you have a tablet, easiest way for me to demo to you, and for you, if you have a tablet, is just to have them sign right here. But I think the text and email thing is pretty nifty. In a real life scenario, I think you probably would do these two the most. But just because I don't want to wait around a couple seconds and wonder where my phone is and all that jazz, I'm just gonna have it signed right in front of me here. I want to see that's a little better next time. Sign it, and then boom, submit. It will take a moment to verify all that information for you.
And just so everyone's aware, they're going directly to the carrier. So once you complete that enrollment, it's going to whatever carrier they applied for.
Alrighty, yes, and then here we are. You have that confirmation that the enrollment is completed. You heard that little, I don't know if you can hear my little email dings or not, but I got an email that I had enrolled in this plan. All of this stuff is here for you to review just in case you have that success. You go down and through. See all that information. So then you could confirm, you could send another email to that person if you wanted to. Or with the email confirmation button right here, or you could save this as a PDF if you're like me and you like multiple records of things in multiple places. You can save that enrollment as a PDF and save it for your own files if you so choose. But as I'm sure you can guess, Sunfire will save that stuff for you. Go on back to the home page and you will see, oh, that person I have changed to enrolled. And that's about it really, right?
I'm just curious, Chelsea, where it says enrolled under actions, what are the actions now?
Oh,
If you
yeah,
remember over-
so now you can view the contact, view the quote, send a personal URL, scope of appointment, or view their enrollment. Good call. Yes. So now there's another item that you can list in that action. You can go look at their enrollment again. So let's say they still want to shop around for whatever reason, or, you could still send them that URL again. You could view the quote you did for them, see what other things that came up. And maybe they want to talk somewhere, you can send them to their scope. I don't know. All those things could be done still through those three dots there. And then if you don't remember every single thing I said to you today in this demo, keep in mind there's going to be recording of this sent to you, and on YouTube, I have a bunch of shorter videos that walk you through each small portion. You could just go run to YouTube really quick, go to the Action Benefits channel. And there's like a playlist of a couple of videos that go through each portion of what I did in shorter segments. So maybe you only want help with that enrollment portion, or maybe you only want, to recall real quick before you sit down with your client, what the difference was between list mode and x-ray mode. You could go through and watch those videos really quick and get that same information.
And you can always reach out to your account manager. If you're not sure who your account manager is, you can definitely call the individual team and we can get you that information. But we would be more than happy to walk you through Coverage for One, whether it's, in a like Zoom meeting or something like that, or even coming to your office if that's easier for you. We can definitely set up those appointments. Just let us know how we can help.
But other than that, I don't see any other questions. So please, like I said, feel free to say them now and forever hold your peace, I guess, unless you want to give us a call later. But thank you for joining me here today. I really appreciate spending time with you guys and letting me show you, strut our stuff, if you will, of our new enrollment tool. And unless there's any other questions, have a great rest of your day. Avoid the snow. If you have any trips you need to do, go ahead and do them now before the snow gets too bad.